anti-science-based decision to send sick, infectious people back to nursing homes. If there were ever the equivalent, the public health equivalent of putting out the fire with gasoline, that's exactly what happened. And I think the report yesterday just shows the tragic consequences are even now becoming more evident.
Again, back to the question, why should we assume that what they're telling us now is correct?
You know, again, I read the report yesterday. I think the report is very fact-based. I think the Attorney General did a good job. I can't say whether it's 12,000 or 8,000 or 15,000, but the bottom line is just this. It was a poor decision at the time that cost many lives. The number of lives it cost was just amplified yesterday by the Attorney General's report. Clearly, nursing homes were the most severely affected population. They were the most at risk, the most vulnerable. The one place you don't send infected patients back to is nursing homes. There were numerous other choices that were better. In fact, every choice would have been better than that. And I just think you're seeing the tragic consequences
they
of
were
that.
defenseless, Dana.
Yeah. And of course, the governor blames the federal government on that. Let me also ask you about this. We have, do you want to comment on that? Because Andrew Cuomo has said that the federal government is the one that gave the guidelines initially.
That is completely non-true. What Governor Cuomo said is the nursing homes had to take back these patients. They were mandated to do that. What the CDC said is under very specific circumstances where a nursing home had all the training, had all the PPE, had all the isolation requirements, all the staff, all the training, then it would be permissible to do so. In no way was this federal government guidance. That is just absolutely wrong, and he can't shift the blame. He has to own this one.
All right, let me also ask you about this. There's these new variants, including the one from Brazil, then we have the one in South Africa. We had the two people in South Carolina test positive with that variant yesterday. The two people didn't know each other. They had not traveled. Because you understand testing so well, as more Americans get tested, do these tests keep up with the variants?
So in general, the tests we have will not detect that it's a specific variant. If you're with a variant, you will test positive, but the normal routine test will not tell you whether you have a variant or not. That has to go to a different type of test called sequencing, where the entire genetic code of that virus is sequenced, or at least the portions that are there. That is done more in a surveillance methodology, not in a routine testing methodology.
I just want to make one more point about these nursing homes. In New York, 70% of the 35,000 deaths in this state were people age 70 and older. It really just, it breaks your heart for what these people had gone through. So there's a push now to break down some of the barriers you tried to set up to prevent opioid abuse during your time the last 4 years. What is your concern now with the new administration about that?
Well, it's probably one of the most inconceivable and anti-science decisions and anti-patient decisions I could ever imagine. Right now, 1 million physicians, about 1 million physicians, can prescribe oxycodone, hydrocodone, morphine, fentanyl to any patient they want. But because of antiquated laws and overregulation, only 66,000 of those 1 million can prescribe medication-assisted treatment that is the number one treatment we have against opioid use disorder. What we did was issue practice guidelines that would allow any physician who can prescribe morphine or oxy to also be able to prescribe that life-saving treatment. The Biden administration reversed this. This is inconceivable to me. Nearly every medical society supports this. The National Academy of Medicine, 39 state attorney generals. There's bipartisan legislation that would support this. And we know that the opioid crisis is getting worse, partially because of the pandemic. Yeah. We expect that there'll be 85 to 90,000 deaths in the U.S. in 2020 due to drug overdoses. The majority of them are due to opioids. And this is one thing that we can do, provide treatment. How can the Democrats be against providing treatment to all those who need it? So I'm really shocked and dismayed, and really want everybody to understand that this is a blow for the treatment who are suffering, of people who are suffering with this chronic disease.
Hope we don't slide back.
Admiral Giroir, we hope you'll come back. We appreciate having you on.
Thank you, sir.